Welcome back to Tipping Point. I'm your host, Kara McKinney. Defense Secretary Pete Hegseth may have a lot on his plate, but he's not using that as a reason to ignore the plight of our veterans. Joining us now to discuss all this and more is Chris Enget, a Purple Heart recipient and Strategic Director for Concerned Veterans for America. Chris, thanks for being here tonight.
Thank you, Kara, for having me back on.
Now, what we just saw in that video is horrific, right? And it's something that a lot of our veterans and active duty service personnel as well have talked about, have complained about, and not much has been done about it. So is that the kind of culture do you think the current Secretary of Defense will be changing, that our troops deserve better?
I think that's a really big point that's going to be made during this administration is putting veterans, putting the soldiers, putting the men and women who have signed their name on the dotted line, putting them back at the focus of what their mission actually is. And then when we bring them home and they're broken, that we get them the care that they need, we get them fixed, and we have facilities and resources that are actually there to help them get back on their feet.
Yeah, and that's what we need, and that's why I love Concerned Veterans for America so much, right? Because it seems our government's always looking for the next forever war to put our troops in danger, and yet the veterans that we have at home, they don't do a whole lot of anything to help them, right? And so that's been a major issue. So when it comes to what our veterans are facing or our active duty service personnel, a lot of these issues, like we saw at Walter Reed, I would say are easily fixable. There could be maintenance, there's money for that, there's budgets for that, and yet the money never ever seems to go to the things that are actually needed. And the money just goes away, right? And the Pentagon, it fails its audits time and time again. And then whenever there are audits of what's going on, they always find money for Ukraine or for some other issue, right? We saw that a few times with the Pentagon, ditto for the VA. So these issues are easily fixable. And is that what it upsets our veterans and our active duty service personnel so much that, I mean, I talk to my brother and others who have served, and it just kind of feels like, you know, you're not cared about. Your government says, oh yeah, we might send you abroad to go die overseas, but also we don't care all that much about you. So, you know, we'll still, you know, serve you bad food. We'll serve you, or we'll make you stay in barracks with black mold. And even at Walter Reed, you have to deal with what we just saw in that video.
Yeah, and that's a really big issue that a lot of veterans are facing today, is that a lot of these resources are going to not actually take care of the veteran. And we're seeing veterans who aren't getting appointments and they're waiting months. I have a friend right here near me that was diagnosed with cancer 7 months ago and still hasn't seen an oncologist. And why we can't get them the appointments that they need, why we can't actually put the money where it needs to be into the facilities that need to be kept up so that the veterans are getting the care that they need. And if the facilities just aren't taking care of them, or they are falling apart like that, that they have an option to go somewhere else to get that care so they can get the next step in their treatment taken care of.
Yeah, and you know, they always like to say, oh, budgetary shortfalls. I mean, the Pentagon and the VA together get what, close to probably $1 trillion. It's hundreds of billions of dollars. There's definitely the money for it. Where's in their mind, it's like, where's the glory in that and doing the right thing and giving the money where it needs to go? They'd rather put it off and fritter it away in issues that will help their careers to rise or can make money for their friends. And so hopefully that's the culture that we're going to see go by the wayside under the new defense secretary. So I also wanted to ask you, though, with this new Congress, the 119th Congress that has now been sworn in as of last month, January, Concerned Veterans for America would like to see, and I have it here, complete the Mission Act. They would like to see it shepherded through Congress and passed. What does the Complete the Mission Act, what does it require or mandate?
Well, the Complete the Mission Act was the bill that they had there during the lame duck session. And currently the new bill that's coming out is called the Veterans Access Act. And it pretty much does a lot of the same things that the Complete the Mission Act did, and that's to codify the access standards, those standards for care in the community that were put into place in regulation for the VA, actually codifying them into law so that they have to be forced. And then the VA can't pull those back like they've been doing time and time again. It's also going to make sure that the veterans within the VA understand what these community care guidelines are, whether they're eligible for them, and the status when they do apply for care in the community. And so it's really going to try to put this stuff all together, that the Mission Act of 2018 put into regulation, really try to put a lot of this stuff back in place so the VA can no longer continually pull this back and prevent veterans from getting their care in the community when they do need that. And so we're going to see some really good things happen, especially in the mental health space. It's going to open the door for more inpatient mental health referrals. And I think at the end of the day, what we are going to see with this Veterans Access Act is that more veterans are going to get the care that they need. They're going to get it when they need it, how they need it, not be waiting 7 months to see an oncologist, 6 months for a mental health appointment. I know just in Montana, there's 17 VA facilities, and out of the 17, only 5 of them have mental health appointments even available for you at the VA. And so this is going to open the door for veterans to be back in control of their own healthcare and their own healthcare decisions and ensure that they get the treatments that they need when they come back home so they can live a life that is fulfilling and meaningful to them.
And that's what we need. And have you guys faced any pushback from the VA on this bill?
We have heard, and we're going to keep getting pushback. This idea that it's going to privatize the VA, and that's just not what we're out here to do. We don't want to see the VA go away. There is a place for the VA. There is a purpose for the VA, and so many veterans rely on the VA. This is just going to open the door for when the VA can't get you in for those appointments, that you have an option to go somewhere else, that you have the ability to get the treatment, and you're just not stuck in this bureaucratic loop of not getting anything taken care of or done.
And what's it been like talking to members of Congress on this bill? What's the reception been like?
So the majority of the reception that I've seen is that there is a lot of, it's because it's taken the Mission Act of 2018 and codifying the majority of that. This is already stuff that they voted on previously. So it's really easy to just kind of get behind this and know that the idea is to support the veterans in whatever treatment plan that works best for them.
No, definitely. And last thoughts to you on this. With the new administration that we currently have in office, one that's looking to end endless wars, right? Looking to bring a close to conflicts that are currently going on around the globe, from the Middle East to Europe and beyond. What are your hopes for this new administration moving forward when it comes to veterans?
Well, when it comes to veterans and it comes to ending endless wars, this idea that we don't need to be in all the conflicts all across the globe. We're not the world's police. And we need to stop trying to send our men and women. We have troops in 159 countries, and it's just not sustainable for us monetarily. And the soldiers that are being injured all across the globe in Syria and Iraq and Africa, and we got a whole host of things that are going on. We need to make sure that we're being realistic about where we send our men and women. And then when we do send them into places where they get broken, that they come home and we fix them, we put them back together, because they have a lot to offer their families and their community and to society. And so we really want to see this administration just put the human dignity back into the picture.
That's what we're praying for, right, Chris? Thank you for your service, and thank you for joining us tonight as well.
Thank you so much. I really appreciate it. If anybody wants to join us, they can go to cv4a.org, hit the button that says take action, and they can sign those petitions that go directly to their legislators.
cv4a.org. Chris, thanks for joining us tonight.
Thank you, Kara. I appreciate you having me back.